Hi everyone. I don't exactly know how I'm gonna do this video or like exactly what it will be. I guess this is kind of for record keeping, plus I might implement it somewhere, but essentially I just came back from the doctor with a referral to get an ultrasound on my testicles because I am scared that I may have testicular cancer, and I feel like that's a very big claim to make. I've just noticed recently that it feels like my left testicle is a little bit bigger than my right. I also have felt like up the top that it just feels like there may be like a lump or two. I thought it might just be like the epididymis, but I checked the right testicle and I don't feel any of the same structure on there. I went into a panic the past 2 days. I have just been so stressed because I know treatment is removal of the testicle. I don't want my testicles removed, and it's just made me feel very overwhelmed. Not only that, but I also have been having some unexplained back pain. I did also ask the doctor about that. I also saw another doctor prior to get an x-ray, which I did yesterday, and she said to me that she thinks it's just muscular. It's nothing to worry about. In regards to testicular cancer, if you do have back pain, it's a sign that the cancer has left your testicles and is actually in other parts of your body, like in your lymph nodes. She checked it out. She was touching my back, found the pressure point where it was, and she said it just feels like a big knot in the muscle. She thinks I just might need to use like a massage gun, use something to loosen the knot in my back, etc. So I'm feeling pretty good about that, thank God. But I did just want to document this because I feel like it's important to speak about, because it's actually the most common cancer that affects men age, I think it's like 15 to like 35. So it's mostly for younger men. I don't really find that I am checking myself very often because it's not something you would think at the age of 24 could affect you. Hopefully everything's fine. Like, I'm sure everything will be okay. The more I think about it, the more I speak it out into the universe, the more I think maybe I'm just overreacting. I think just because of the back pain plus possible lump plus like the size potentially being a little bit different has made me feel like there might be something when maybe there isn't. But as my doctor said to me, it's good that I'm at least coming in and getting checked, because at the end of the day, it might be nothing, but it's just so good to check, get an ultrasound, make sure everything's okay. And that way, at least if something does arise in the future, I've got something to compare it to. But if it is something serious, then I'm getting onto it early and I'm making sure that I can get treatment. Even if that does mean removing a testicle, which I really, really do not want. Like, that just makes me feel really uncomfortable. It is what it is. And if it means that I'm not going to die from cancer, I mean, obviously fingers crossed, then that's the way we're going to move forward. Touching on me feeling uncomfortable with needing a testicle removed, I mean, I think that's for obvious reasons. Like, I don't think anyone wants to get a testicle removed. And I'm sure a lot of guys could agree with this. It feels very personal and it makes me feel very vulnerable, because I feel like that's like a sacred part of your body. Do you know what I mean? Like, that is like your whole manhood, and it just makes me feel weird to think that it would have to be removed. Let's say I had an issue with maybe like a kidney, maybe I had it in another part of my body. I would not be that opposed to having to have it removed. As much as it's unfortunate, I wouldn't be feeling queasy or upset about it, especially because I'm not someone that drinks. But having it be in your testicle, it does pose a few questions of, you know, like, is this going to change my testosterone levels, my hormones? Is it going to make me infertile? Is it going to lower fertility, which you would assume having half the amount of testicles and sperm producing cells, that would be a possibility. Is it just going to be an insecurity? Is someone going to find out about it and they're not going to like love me for it? It's a lot, and I guess really it all boils down to just like self-love and being confident in yourself and knowing that you're making the right decision for you. And obviously it's medical. I'm not doing this for fun. There's just lots going in my mind, and it does make me feel a little bit overwhelmed, but I feel like this is an important message to share, even if it is nothing, just regarding actually getting checked and making sure that everything's okay down there and that I don't need to move forward with this. We'll see how we go. I'm going to call up the imaging clinic at 8 o'clock because that's when they open. Right now it's about like 7:40 or something. Make sure that they bulk bill and book an appointment with them to get it screened as early as possible. The good news is, because I'm not working at the moment, I am pretty flexible. I don't think I'll be able to do it today. From tomorrow onwards, I should be fine. Let's see how we go. Staying optimistic.
A few moments later.
Okay guys, good news. I have finished my scan. I'll get to more of that when we're in the car. I had a really nice guy. I wasn't allowed to film in there, I believe, just because I was nude. I did ask and he was like, absolutely not. There was no chance. And I was like, okay, all good. Just wanted to check. So unfortunately, no footage inside there. But like I said, good news. All went well. I'll update more in a little bit. I'm back in my room. I was going to do my next update in the car, but it just was not working out for me. There was someone mowing the lawns right by the car. The dash was like not even, so it wasn't sitting right. It was like like kind of tilted. It just wasn't giving. So anyways, I've decided to do it here in my room. I got my DJI microphone as well. Not that I really need it because I'm inside, but I just felt like this is kind of giving podcasts. So I was like, okay, let's sit down and talk and I'll have my little fluffy mic. So anyway, onto the scan. Like I said, I got to the clinic. I was actually running a little bit late. Like I was early for my appointment, but they said to get there 15 minutes early. And I think I got there at maybe like 7:52 or something. I was just like struggling with parking. There was street parking, but they were like, no, park in the building. Like it's easier. And I was like, whatever. Should have just parked on the street right out the front because there were literally parks directly by the entrance. But I was like, no, I'll go underneath. So I went around the back, and then to park underneath, it was free for 30 minutes. And then it's like $10 after that. I think it's like $10 for like the next 30. And I was like, look, I don't know how long my appointment's going to take, but I don't want to pay $10 on parking when I can park out here for free. So I parked on the street, and then I went into the car park to take the elevator up, went up to the wrong level, walked out. I was like, where the fuck am I? And then I got back in the lift, went to ground floor, found the place, filled out my paperwork, and then I was waiting, which is when I did like my little video, which you would not even be able to hear me speak. I was a little bit nervous. It all went pretty smoothly. Like I didn't really know what to expect. I did ask if I could film, and he was like, absolutely not, which again, totally fair because my nuts were out. Probably not the best time to film. Not that I wanted to film that, like I don't care about that. I just wanted to maybe film the screen just so you could kind of see what it looks like. That being said, hopefully when I get my results, maybe I can like insert a photo or something of what's going on. He was really nice. He actually had worked with my friend Jen from Sydney. As you may know from any of my Sydney vlogs, I always end up seeing beautiful Jennifer. He actually knew who she was, so we were talking about her while he was scanning my nuts, which was a little bit interesting. Going into the appointment, I was so nervous. The past few days, I have just been having this dread within me because I was so nervous about what possibly could be going on. Obviously, as we know, I was suspecting maybe I'd have some kind of like cancer or a tumor or a cyst. That itself, as much as it's bad, that wasn't the part that was scaring me. The part that was scaring me is that if that was the case, I would have to have a testicle removed, possibly both if it had spread. But from what I was aware of, it was only on the one. So I was going into it feeling very nervous, very uncomfortable. I just had all these different questions going through my head and then thinking, am I overthinking this? Am I reading into it? Is anything even wrong at all? Am I making something out of nothing? There was just lots going through my mind. And anyways, during the appointment, he was scanning them both. We are waiting for the results to be properly analyzed by his superior, and then I have to consult my doctor regarding it tomorrow. But he showed me the screen after we were done, and he said, look, it just looks like it's one of those veins in your testicles. And he basically called it a lazy vein, which essentially just means that I almost have like a varicose vein in my scrotum. Obviously this doesn't show up, like it's not like something that you would see on the sack, otherwise I would know that by now. He just said that it can be common where the plumbing essentially, how the fuck do I say this? I'm trying to think of doing it in like a proper way. I don't know, I'm not a fucking medical professional. Essentially what he said is that it can be common for men, especially when they're younger, to just develop these lazy veins where the valve where the blood goes through to prevent the backlogging, I guess. I'm so sorry, my terminology is not giving in this video. It can just be a little bit leaky or not the best, so the vein can get a little bit bigger. Obviously it's not huge. He said it was about maybe like 3 millimeters in diameter, so obviously it's still very tiny, but relative, it's bigger than what it should be. It can be common. There's no issues regarding it. It's not really that big of a deal, which is great. Like I said, we will be consulting with my doctor, so we're going in there tomorrow and we'll go over it, talk about any treatments or anything that she recommends. But from what he said, there's definitely no cyst, no growth, nothing at all. I like cannot explain how much better I'm feeling. If it was diagnosed as some kind of a cyst, a growth, or a cancer, my testicle would have to be removed. That is just not something you want to go through at all, especially at my age of 24. I still need them and I still want them. It just is something that made me feel so uncomfortable and something that I knew that I would have to come around to and something that I would have to just end up feeling okay with. I just feel like it would take a part of me away. And I feel like any guys out there would be able to understand. I'm extremely grateful that I'm not someone that's going to be needing any removed. Touch wood. It is important that everyone is getting tested. If you have symptoms, the earlier that you do get a diagnosis, the better the treatment will be. There is extremely high survival rate for testicular cancer, especially if it's caught early. You may have to undergo surgery, but it's better to do that now and at least come out with one testicle than to come out with none. I'll bring you to the doctor's appointment tomorrow just so that way we can discuss the results. I'm just so grateful that everything so far is turning out really good. I just cannot thank the team enough and everyone for being so helpful and for getting me the help that I need, taking it seriously and not making me feel bad for wanting to take my health seriously.
No testicular lesion, your epididymis, which is attached testicle, that's normal. Small left varicocele. What does it mean? It's like an inflamed vessel.
Yeah.
Which is not really a problem.
Yeah.
Is it painful?
Since I've noticed it, I have noticed a little bit of dull throbbing pain, but not anything too severe. Which is good because I was really scared it was going to be something a bit more serious.
No, not really.
Yeah. Is there any treatment or just leave it be?
Really.
Yeah.
So no, we just leave it.
I can live with that. Okay guys, back in the room once more, and I thought I would just touch on, I guess, everything that's happened in this video and wrap this up real nicely. As we saw just then in my doctor's appointment, the doctor did diagnose me with a varicocele, I think she said. I can't remember how to say it. This thing right here, essentially not too big of a problem. When I searched it online, it did say that there is a chance of infertility or something, but she told me not to worry about it unless I have severe pain or ongoing pain. Then that might be a bit of an issue and something that we could then treat. Like I said a million times, I'm feeling very relieved. I went into this thinking the worst. Coming out of it with just an enlarged vessel, I do feel a lot better. It is what it is. It's not necessarily something that's putting my life at risk. It's not something that's giving me ongoing pain. It's not something that's keeping me up at night. It is just something for me to monitor, and obviously I will continue to monitor my testicles moving forward. Thank you for watching and coming on this journey, and I hope maybe at least one person is feeling inspired to check themselves or take some action, going to the doctor and following up on something you think may be potentially threatening, because at the end of the day, it's nice that I got onto it and now I know for future. And I do just want to give another thanks once again to the team that did help me and took everything seriously and got me the help that I needed. I'm very grateful. If you are new here, I will have a lot more content coming. I am going to Europe for 3 months, so I will have a lot of travel vlogs and a lot of stuff on that. If you are interested, feel free to stick around and tune in. Otherwise, thank you for watching. I'll see you in the next one. Bye. Sorry, I'm doing ASMR now. I need to stop.